Good morning, America, and welcome to this morning's Going on Offense webinar. My name is Daryl Moon, and I'll be your host today. This is our 8th webinar in our new series on workplace mental health and well-being best practices. The sponsor of this series of webinars is a very uniquely proactive mental health and personalized well-being program called Resilience Pro. Now, we all know that the pandemic has certainly ended the lives of most Americans. Businesses in this country have drastically been impacted. These webinars, in fact, we've just passed our 50 webinars that we've recorded and put on our goingonoffense.com website. Anyway, these webinars that we've been conducting for the last 7 months have been focused on going on offense to address the impact the pandemic is having on the emotional well-being and mental health of individuals. Today's topic is on assessing mental health needs. Now, we're probably all recognize how important it is to address mental health needs. So we're not going to talk about how important it is. And most of you are very familiar with health risk appraisals that we've been using in the population health industry for many years. We're not going to talk about health risk appraisals either. And why? Because mostly they're taken like maybe once a year. There are many mental health assessment tools like the OQ45 and the PHQ9 that are wonderful outcome measurement tools. And there are many others like the Altman scale for mania and the GAD-7 for anxiety and the PCL for PTSD and others. But we're also going to talk about those today. The biggest problem with mental health is the fact that 57% of adults with mental illness receive no treatment. And people wait on average after symptoms appear 10 years before seeking help. That's the huge problem that we're going to address today. And we're going to address that by finding out how do we help identify those people early, even before they might ever reach out for help, and address those problems and be able to engage those people in resources early before they become significant problems. Today, we're going to talk about the innovative way to assess those needs with a non-mental health assessment tool, which, by the way, because it's a non-mental health assessment tool, it actually gets around one of the biggest barriers to mental health. We all know that there's a huge stigma associated with mental health. And so by attacking mental health with a, here, I want you to take a mental health assessment tool, we're going to miss a lot of people. So we're going to, today, as my guest panelist, I'm going to show you some technology. It's going to be a demonstration of some technology that employers of any size can implement at no cost. The exciting thing is that this technology is being made available to companies across the country to allow them to begin to identify and assess what the mental health needs are early so that interventions can be brought in to support and assess those. Now, perhaps you've heard about a Pulse survey. Pulse surveys have been around for about 4 or 5 years, and they are, just like it says, it's a pulse, and it's a very short survey. So the idea of a pulse survey is to simply ask a few questions, not very many, and send it out on a regular cadence. Well, this technology takes that concept of a pulse survey and simply builds a well-being tracker. And so it's kind of like a Fitbit or a Garmin or an Apple Watch, but because it's really hard to measure someone's various well-being areas other than physical through a tracker, this well-being tracker allows employees, individuals, spouses, family members to track their well-being by each category on a regular basis and then be able to see how they're trending over time. So I'm going to give you a bit of a demonstration today of what that looks like, what the tools look like that actually are available to track and trend over time. And we're going to start with the actual pulse survey. Now, again, the way it works is a text message is sent out to everyone in the population that has enabled text messaging on a regular basis, like once a week. That seems to be the cadence that's working well, is to send out an assessment of just asking people, how are you doing? And within 10 or 15 seconds, click on a happy face or a frowny face to say, tell me how you're doing today. So let me just demonstrate that for everyone. I'm going to show a video, of what that looks like. So participants or members would get a text message, they click a link, and that would take them to a survey, which is going to really just ask, 8 simple questions that they can easily click on the face that best represents how they're doing. This one's on how's their job. This one's on, intellectually, how stimulated do you feel? Physically, how do you feel like your overall physical well-being is? Your nutritional well-being, your personal environment, and your financial well-being. How's that going? And that's pretty much it. People within 10 or 15 seconds can take that. They can then open their app, or they can open a browser, and they can look to see, well, how am I doing in each of those areas? What's my current score, and how has that trended over time? So I can take a look and see, how's my social well-being over a daily basis, weekly basis, monthly basis? How's that been going for me? And I can even set up a specific time frame, but I can look at each of the 8 categories of well-being and see, how have I been trending over time? All right, that concludes the little video. So now let me take you into a demonstration of the actual website. We're going to go walk through that just a little bit. So here's an account, a demonstration account that shows that when you log in through a browser, this isn't the app, but the app and the browser look very similar. This is a way to look at how I'm doing right now. So my latest score that I've indicated basically is telling me that. I can come over here and see what that looks like. If I want to see what my overall average well-being score has been over time, I can simply click on this graph and take a look at that. Or I can come back and say, well, how am I doing in each of the categories? I think what you're going to find very interesting to see is, towards the end, I'm going to show you some graphs of some real data that that's been used to identify people that are struggling. Again, let's go back to the home page. Okay, so if I want to take a look at any of the specific areas, I can simply click on social. And from here, I can click on emotional or occupational or intellectual. Each of the 8 categories of well-being: nutritional, environmental, or financial. And I can, again, take a look at it over any period of time that I may want to. I want to encourage people as we go through this to remember a couple of things. One, we're looking for questions. If you've got a question about the technology, again, that's free for employers to implement, simply send your question through the question box. There's also some information, both a handout as well as some graphs that you're going to see in just a minute, that are available through your control box, that will give you an idea as to the kind of data that this survey, this well-being tracker, is helping us identify people who are struggling to where individuals can reach out with compassion to support those people. All right, so now that I've kind of shown you how the graphs look, I'm going to take you back to the home page. And if I wanted to, as I've logged into an account here, simply click on and update my numbers and update any of those, I can do that through this interface. And I can submit my answers. Go back to the home page, and now here's my updated numbers. Now what I'd like to show you is what an employer, the organization that implements this, would see on their end. So if we go to an employer portal, as you can see, the employer gets aggregate data. Now this aggregate data can be divided into departments, or they can just look at employees only, or they can look at spouses only, or they can look at employees and spouses, but you can't drill it down to an individual. Now, obviously, for an employer, they're looking for more of an aggregate trend and aggregate data. That's how the group's doing. So on this part of the graph, this dial graph, this is where the population is currently. And again, if I come up here, I can drill this down by department, or I can drill it down by employer, spouse, or otherwise. But if I look at each of these, I can tell where each area is right now. But most importantly, I can trend over time how each category of well-doing is doing with my group, and identify if there's an area that I want to emphasize as an organization based on where those trends are. Now let me show you what this looks like from an administrator's perspective of being able to take a look at the data and the kind of data that we're gathering by implementing this. So let me bring up a PowerPoint here and actually show you some graphs of the actual data that we're gathering from people who are participating in this program. And again, if you've got any questions, feel free to submit those. We'll be happy to address those. So, first of all, I want to show you, here we go. This first set of graphs is the average well-being score looks like by a group of individuals. And we'll kind of see how some people are completing their well-being tracker on a regular basis. Other people might be doing it just once a month, but how the overall average score of all of those 8 categories is looking by person. So someone who has pretty much, been very actively participating. Once a week, they're answering those questions, and for the most part, they're doing pretty well. The average across all 8 categories is almost a 5 in every case. Here's a person that's only answered the survey maybe 5 or 6 times. And, if you take a look at the scale here, pretty much they're scoring between 4 and 5. They're doing pretty well across the board in all categories. Here's a person that's been very actively participating in the well-being tracker, putting their information in on a regular basis, and overall has not been doing well, and clearly identifies individuals who are struggling across the board in all areas of well-being. This last week, it looks like things have improved a little bit, but that would be a person that definitely would be reached out to with compassion to support them as they're struggling. And again, we're trying to cut down that idea that people wait 10 years on average before they'll reach out for help. Let's identify those people early, and let's find what the problems are by actively reaching out to them. Here's a person that between 3.8 and 3.5 have pretty well scored all their scores within that category, but they've only taken the survey 4 times. Here's a person that's been pretty close between 3 and 4 on a regular basis. Here's a person that's showing over time that they're actually improving just a little bit across the board. In fact, most recently, they're pretty much saying they're 5s in every category. There's a person that between 4 and 3, it's pretty much, they've only done it 3 times. Here's another example. Here's another example of somebody who's struggling that clearly could use some support, because if you take a look over here, they're scoring between a 1 and a 2 in almost every category in order for their average to be at that level. And now here's a person that between 2.5 and 3.75, they're kind of trending down. So it's not good, probably ought to be reaching out to that person. Now let's take a look at that person's specific. So let's take a look at how each 8 categories has been tracking for that person. Let's take a look at their social well-being. Oh, they've been answering the question, I relate and connect with other people in a way that's fulfilling to me. For the most part, they've been scoring up and down between 3 to 4, down to 2, up to 4, down to 2. Emotional well-being, they scored 2 at the start, which isn't very good, went up to 4, but immediately came back to 2, and have been kind of ranging between 2 and 3. They're not doing very well. Obviously, somebody that we should reach out to and try to support. And again, the question is, I'm aware of my mental health and take steps to address my stress. This question is, I find fulfillment in my work. How's your job doing? Well, the person's not very happy, going from 1 to 4, down to 2, up to 4, down to 1, now it's a 3. Some problems are going on with the job. Intellectual well-being, well, 4, then 5, down to 3, up to 4, pretty much in that. Physically, they've been up, they've been down, they've gone from 4 down to 2, 4 down to 2, up to 3, struggling a little bit physically. Nutritionally, they've been up and down between 4 and 2, 4 and 2, 4 and 2. Personal environment, been around 4 and 5, pretty much stay the same. A couple weeks ago, went down to 1, but back up to 4. So the personal environment, my community contributes to my safety and overall well-being. It's okay. But here's the one that tells all. My ability to manage personal finances positively contributes to my overall well-being. Obviously, when we look at this graph, here's a person that's gone from 4 back 11 weeks ago, probably back in July, now 6 months later, they've continually struggled. Obviously, this person could use some support, whether it's the way they're managing their finances, probably somebody that's been very much affected by the economic pandemic. So again, this was their overall graph. So from the overall graph, you really wouldn't tell that there's a major problem going on. And obviously some concerns, but when you take a look at their specific graphs, down by person, clearly this person is struggling with finances and could use some outreach. Now, I want to encourage people to ask questions. Please send in your questions. We'll address those questions. And while we're waiting to see if anybody has any questions, let me take you on a tour of another aspect of the software. And again, the software there's no charge to implement it. There's no charge for ongoing. The only cost at all would be for someone to monitor and to actually outreach to people. But the technology can be distributed and put in place at any size company, anywhere, to begin that process of really assessing mental health needs. And you know, mental health can be shared in lots of different ways. Could be coming out in social or emotional or financial. So let me pop back here to the employer portal and show that in addition to being able to monitor how each category is going for their group of employees overall, it also allows the employer to monitor what's more important. So employees through the technology can answer a more complete questionnaire that asks questions about their overall health, but also asks questions about do the benefits that your employer offer attract and retain you? Do each of these well-being categories represent the same value in your mind? Or in fact, are there differences? So here in this particular example, we can see that for this employer, social well-being is pretty important. Emotional well-being is pretty important. Intellectual well-being is not very important. I mean, look at the difference between those who say absolutely essential up here under emotional well-being compared to under intellectual. It doesn't seem to be that important, which gives an employer a lot of information about where they want to focus. Maybe intellectual well-being is something that people score very low on, but if it's not that important, then it may not be where they want to focus. Physical well-being, nutritional well-being, financial, personal environment, and so forth. Now, let me also show you that an employer can manage not only the well-being through their portal, but can also be managing whether their employees appreciate the benefits being offered by the employer. Do they appreciate the culture at the workplace? Here's some interesting data that this software, again, that's free, offers employers. It's like, what attracted employees to come and work here? Was it the pay? Was it the culture? Was it the benefits? And now that they're working for the employer, what's the likelihood that they will stay? Is it pay that keeps them? Is it culture that keeps them? Is it benefits that keeps them? And that's very important to an employer who's trying to decide, you know, what's going to keep my employees here, which is often one of the most important reasons employers offer benefits. Now up here, I want to show you that we also can be gathering information on healthcare satisfaction. Do the employees feel like the healthcare that's being offered to them is actually good? And they can be giving feedback on, you know, do you feel like that you're satisfied with those services? Is it easy to use? And is it easy to navigate? Is the healthcare system there when I need it? And does the healthcare system provide quality, effective work? All of those are important monitors that employers want to know from their employees, and the technology that's free offers them to do that. So we have a question. One of the questions that came in is, how long does it take to implement this? And is it only something that can be implemented like at the beginning of a plan year? It's a very good question. So this technology can be implemented literally within days. There's very little information. Employers can actually, through their employer portal, upload a full list of new employees through a bulk import. So it's very easy to bulk import thousands of employees that they need to, and within just a few days, kick off the program. Obviously, there's some communication involved just to let people know that it's available, but as employees enable their account and turn on text messaging, they begin to participate in these weekly text messages that go out and ask them to update how they're doing on their well-being. The software involves a lot of there's a host of great content that's also included in the technology. So it doesn't take very long and can be implemented almost at any time. Another question that just came in is, does the employer, or do employees know that the employer doesn't have their information? That's an incredibly important question. Confidentiality is huge. People are not willing to share information if they feel like their employer might know about them specifically. So the software has been built in a very specific way to where employers never know the individual and how the individual's doing, so that the employee can feel confident and that their information is confidential and that they may not lose their job based on the information they're sharing. Another question that just came in is, who does monitor them? So Resilience Pro, which is the sponsor of these webinars, offers not only the technology for free, but also for a very nominal fee. It's less than $2 per employee per month. The resources of not only having employees be able to call and talk to a coach about things, but having a coach assigned to everybody in the population to be monitoring the population so that they can be reaching out to people that appear to be struggling. Very good questions. Can an employer have their own coaches? Yes, actually, if an employer said, look, I've already got a health coach within my population, I've already hired someone, can I simply access the technology and have my own coach have an account, and for a very nominal fee, they can have their own account, and the employer can have their own system monitoring their employees, reaching out to those employees. Obviously, if you're going to have your own people managing the technology and being aware of people's well-being and providing it, you'll want to ensure that there's a firewall between the person, the coach, who may be monitoring and reaching out, or a psychologist or a therapist. You know, whoever it is that's kind of managing and monitoring each individual. You want to make sure that you've got the proper legal information in place, the legal documents, to keep a separation between the person who knows the HIPAA information and the people that are hiring and firing and obviously affecting people's jobs. All right, looks like there are no more questions. If there are any, please feel free to send those in. Let me thank you for your attendance today, and let me just mention to you that Resilience Pro is the sponsor of this series of webinars, and a brochure describing what this solution offers is available through your control box that you can download. Our next webinar, which will be next Wednesday on December 9th, we'll be discussing best practices of integrating mental health and well-being. So please join me next Wednesday on the 9th at 9 o'clock Mountain Standard Time in the morning. As a reminder, the recordings of these are available and can be found on Going on Offense. We'll be posting this particular webinar later today on Going on Offense, that you can go back and check on it. That website also consists of a host of other resources, suggestions and ideas that employers can implement, or individuals or families can implement, helping them deal with the emotional impact of the pandemic. We suggest you check them out and take advantage of them. All right, thank you so much for joining us today for this webinar, and have a wonderful day.